NHS Grampian are looking forward to welcoming students of all professions back to practice placement experiences within all of our healthcare settings. This short video provides information on some of the changes that have been put in place across our healthcare sites as a result of the Covid-19 pandemic. Most hospitals now have a designated entrance. The bigger hospitals, ARI and Dr. Gray's, have a volunteer or member of staff at the entrance, and they are required to see your ID. Your university ID is acceptable, so have it visible and don't be annoyed if they ask the purpose of your visit. Other healthcare settings will have local measures in place. For instance, you may be asked some health questions about symptoms or have your temperature taken before being allowed access. On entering the healthcare setting, please gel your hands and put on one of the supplied face masks. You're expected to wear a face mask at all times in all clinical areas of hospitals and in any area where the public have access, including corridors, lifts and stairwells. Do not touch your mask unless you are donning or doffing. If it is unavoidable to touch the mask, please gel or wash your hands immediately afterwards. Please do not hang the mask around your neck or wear it with your nose uncovered. Hospitals are not exempt from the 2-metre physical distancing guidance. You may see a full-sized Highland cow promoting keep your distance. Please stay mindful of this throughout your day, observing a variety of signs. There may be instances in areas where arrows mark the direction of travel you should take. These areas may include stairwells, departments or clinics. Please adhere to these, especially during busy times. In order to maintain physical distancing in all areas of the healthcare setting, rooms may have signs indicating maximum occupancy at any one time. You may find some areas of your healthcare setting are colour-coded according to COVID risk, red being highest risk and green being lowest. The green areas will still require you to wear a mask. Please check with your practice educator, clinical supervisor or PPE champion regarding specific requirements. Red areas are for patients who have tested positive for COVID-19. You may require additional PPE for this area, so again, check with your clinical supervisor or practice educator. There may be occasions when you will be required to wear an FFP3 mask, for instance, when an aerosol-generating procedure is being performed, such as intubation, procedures within dentistry and currently CPR. If this is required, your practice educator, clinical supervisor, mentor or manager will ensure you are face-fit tested beforehand. If you have been face-fit tested in the last 4 years, it would be useful to bring in your fit test report. When in dining rooms or restrooms for breaks, there is not a requirement to wear a face mask when eating or drinking. Please ensure you don one on leaving the area, and of course be scrupulous with hand hygiene. Keeping our workspaces clean is a responsibility of us all. Please wipe down frequently touched office equipment regularly, and more so if it is shared, with the wipes that are available. Please remember to gel or wash your hands afterwards. Hand hygiene is considered an important practice in reducing the transmission of infectious agents which cause hospital-acquired infection and, importantly at this time, coronavirus. Performing hand hygiene is the single most important thing you can do to help reduce the spread of infections and protect you, your family and those around you. Please hand wash and use hand gels regularly and as appropriate throughout the day. It is essential to correctly dispose of your face mask on leaving the healthcare setting. For office areas, face masks can be disposed of in the black bin. However, in all other areas, please dispose of them in the orange waste stream and please gel your hands or wash them after removal. We hope this video has provided useful information and we hope you enjoy your practice-based learning experience with us. Should you require further advice and guidance about your practice placement, please get in touch with your clinical supervisor, mentor or practice educator.